Hi, everybody, and welcome to Common Narrative. I am Crystal Haynes, and you know what we do here. Common Narrative examines the media's effect on public perception across all lines of diversity, and perhaps more importantly, we really go behind the headlines and unpack the civic and social issues affecting your life. According to the CDC, Black women and women of color are much more likely to die due to childbirth-related complications than their white counterparts or suffer from medical complications. And we have a robust show, a lot of three dynamic women that are going to be joining us here today to talk about this particular issue. Representative Liz Miranda will be joining us in just a few minutes, but I'm also here with doula Nneka Hall and advocate Timoria Saba. Ladies, welcome to the show, and thank you so much for joining this conversation.
Thanks very much, Crystal. This is Timoria. Nice to be here with you today.
Likewise, thank you so much. This is Nneka.
And so I wanted to, you all are joining me via phone. Representative Miranda will be coming into the studio here to talk to us as well. I want to start with, I don't know if folks understand that this has been an issue for a very long time. The CDC put out numbers, more than 2 years ago when I began reporting on this. Timoria, you've been an advocate in this space. You have personal experience in this space. I wonder if you could talk to me a little bit about your background with this and your advocacy. And then, Nneka, I'm going to bring you into the conversation, ask you a couple follow-ups.
Sure. So for those of you who don't know me, my name is Timoria Saba. I suffered a postpartum hemorrhage in April of 2010. And it was actually not until about 3 years later that I started to do the research on the statistics. And that's when I first learned that Black women die during childbirth or pregnancy complications at 3 to 4 times the rate of white women. And so that was a real turning point for me in which I decided to start to advocate for women who had experienced the same exact thing I did, both those who, like myself, lived through it and also those who unfortunately have tragically died.
So in this advocacy space that you're in and you're talking about, I mean, do you find that folks are surprised when they hear these numbers at all?
At this point, Crystal, it's like the jig is up, right? We know it by now. And I would say, sure, 5 to 10 years ago, it was very shocking. At this point, there's been so much media attention. There are people like myself, people like Nneka, legislators like Representative Miranda, and several others, both at the state and federal level across our country, who have been talking about the disparities in Black maternal health for years now, that now it's just a matter of people wanting to commit to actually implement the things that will bring about better outcomes. It's just, at this point, there's no more mystery to it. It's been researched, it's been studied. We all know what we need to do to fix it. It's now just a matter of making people do those things.
Nneka, I want to bring you into the conversation and talk a little about your experience as a doula and really trying to represent women of color in these spaces. What are you noticing?
I'm noticing that we are still not being listened to. I'm noticing that our bodies are still being used to for research purposes, to find out what to be experimented on. I'm finding that oftentimes, if you don't have a doula and you have melanated skin, your outcome is a lot different than it would be if you had a doula, and a doula of color if you are a person of color. There are so many things that happen in birth that you don't know about until it happens. So it's imperative, it's life-saving, not just in the prenatal space, but also in the postpartum space, for you to have that support system in place, that doula, that familial, that community support, so that if things do go south, your voice can be lifted high.
According to the American Journal of Managed Care, healthcare providers say that, in terms of causes for all of the these outcomes that we're talking about here, right? In terms of causes, they want providers to account for social factors, looking into someone's health, trauma, stress, violence in their neighborhood, healthcare access. On the medical side, cardiomyopathy, preeclampsia, eclampsia, hypertensive disorders are all part of this conversation. But what about these interactions with doctors do you think really, I guess, end up contributing to these rates that we're hearing about?
I think not listening to yourself. We're taught at a very young age as Black and brown people to trust our doctors. They have all of this education. So we're sort of given permission not to listen to our bodies, not to listen to what's innate within us. And that's the problem. If you know that something is going on within your body, but your doctor is telling you something different, and you trust what the doctor is saying, that's the problem. Always defer to your own experience, your own body, what you're feeling, what you're seeing. And I think that has a lot to do with it. And also, doctors are so medicalized. They have book knowledge, they do research, and we're often not included in that research, not enough of us. So when they have their findings and their outcomes, it's often not favorable for us meaning those members of the BIPOC community.
I just
Nneka,
wanted
jump
to
in
add
on
that.
this.
Oh, hello?
I was saying, go ahead and jump in on this.
Oh, yeah, I was going to say, the one thing that you didn't mention, Crystal, in the social determinants of health was racism. And we know that, especially within the last year, racism has been declared a public health crisis, right? But what actual actions have we seen taken to address how racism in healthcare, it is addressed between providers, the systems they work for, and with their patients? So what we've seen really is a bunch of organizations putting out statements. We haven't seen the same organizations actually saying, here's our statement, but this is also what we're doing as an organization or as even an educational institution, like medical schools. What are the steps being taken that will actually address this within these institutions where people are learning how to treat patients? It all starts with education, because education in itself is a social determinant of health. So if you're not being educated about different cultures, and when I say that, I mean cultural humility as well as cultural competency, if you are not taking classes on anti-racism, if you're not even socializing with people who are different from you, how are you going to treat someone who comes to you without even having just the basic knowledge of what their background might be, their environment in which they grew up, how they were affected by that environment? And when I say that in particular to Black and brown people, what I mean is the cumulative effect of racism over that person's life course, because all of that contributes to that person's health.
And I want to bring into the conversation Representative Liz Miranda, who is here, in studio with us here in Hyde Park. Welcome so much to the conversation. We were just talking, starting with Nneka Hall, who is a doula, and of course, advocate Timoria Saba. So welcome into the studio here.
Hello, good to see you, Crystal. Feels a little slow right now, sorry. And to Timoria and Nneka, my sheroes, how are you guys doing?
Hi, Liz. Nice to hear your voice.
They're the super cool queens,
Yeah.
okay? I've learned a great deal in 2 years from them.
Thank you.
Well, Liz, I want to talk to you, or Representative Miranda. I want to talk to you about this legislation that you've really been championing at the State House. And when you start into any position, you were new to the State House, you were just gotten elected, but this was one of your number one agenda items that you really wanted to tackle: Black maternal health, saving Black women. Talk to me about why that was so important and why that was so high on your priority list.
It was two things. One, my first week as a legislator, I went to a March of Dimes presentation. Essentially, they told me all your zip codes basically have the poorest maternal health outcomes in Boston, and also Mattapan and Hyde Park. So I sat there in a room full of new women legislators. The only other Black person in the room was Rep. Nneka Hall. And we were devastated, right? Here's another list where we're at the bottom, right? It's not even bad enough that me and Nneka gave 300% growth to the number of Black women. So we had joined Rep. Tyler. So then was the second issue. We're Black women, hearing about Black women. So when we left that room, we knew we had to do something. We didn't know what, but that was it. The second thing is I never knew what to call this, right? And it brought me back to so many memories when I left the room, because I felt defeated. And I was like, I'm not a doctor. I'm not a doctor. I'm not an OBGYN. I was like, what can I really do to save, women? I thought about my sister and realized that I had put in the back of mind before my brother was killed. A lot of people know this, but my sister gave birth to a baby that didn't make it. And I hadn't thought about Mila in that whole time because I think it was just too painful, right? And then I thought about my friend who has a scar through birth trauma. And then my other friend who spent a small fortune to get a doula because she was alone, right? She had broke up with her boyfriend and was about to give birth and was like, I don't know what I'm doing. I need help. But she has a good job. So she was able to get that doula. And then I thought about my mom, who told me about the experience of giving birth to me as a teen. And then when she had my sisters, she couldn't advocate for herself. She didn't speak good English. So they made her get a C-section. So I think that for me, it was like divine purpose. It was like, you're going to do something, you're going to listen and learn and help to mitigate. Because I heard a little bit about what my sister said, and it's true. Government is as racist as any other system. And I'm a freshman. So they're like, who are they going to listen to? Right? And so that's what started the journey.
So what do you think your representation means in terms of this conversation? Because when I started reporting on this 2.5 years ago, people were shocked. They were like, how is this happening? In the United States, in Massachusetts, do we have a maternal mortality rate that is worse than Uzbekistan? And so what do you think your representation matters to this group?
A couple of things. I think the first thing was that it is a public health crisis. And good is not good enough. Massachusetts has this crazy faux liberalism that kills me. We're very conservative. We're very moderate. We don't want to talk about racism. It makes us uncomfortable. How could Massachusetts be racist? We have Senator Warren and Senator Markey, right? This is the whole energy. And so when I started talking about the issue, it was like, one, here's the data. Massachusetts is the leader in bio life sciences, entrepreneurial, we rival the West Coast, medicine, education, and even here in Massachusetts, we're not listening to Black women, and Black women are dying 2 times the rate of white women. That is unacceptable. I don't want to die. I said in a bunch of my hearings that I'm not a mom yet, and I've thought a lot about my journey as a 40-plus-year-old woman about giving birth, and it's scary. It's scary for a lot of other reasons, right? But the fear to think about, even here where we think we're the best, we're causing harm, lots of harm to Black families. And that's period, point blank, right? And so what started the conversation was I wasn't going to lower the barometer, right? It was yeah, you want to start this commission, but that's not the only place we need to go, because if there was any other group of people that were dying at the rate that we're dying, that the outcomes hadn't improved in 50 years, they're actually rising, right? So as medicine has improved and healthcare supposedly has improved, why is this demographic still suffering? And third, when I looked at the issues, how an educational background didn't matter. Your zip code didn't matter. It didn't matter how much money you had, you know, and a lot of other social determinants of health. You see that, you know, Timoria mentioned, like having more education sometimes will protect you from certain things because you have the knowledge to be able to advocate for yourself. In this case, doctors or Black women doctors are going through the same thing as a young immigrant person in community. So I switched the conversation. It was like, this needs to happen. And I really want to shout out these women because they work tirelessly after their trauma. And this is something that's important to acknowledge about Black women. We work through our stuff and try to save everybody while we're trying to save ourselves. And then we still got to deal with the microaggressions. And so I dealt with a lot of microaggressions with the other legislators who were white. And they didn't even realize what they were doing to me. They would often silence me and speak up in spaces. And I'd be like, hey, you're not going through this. When you leave this building, you're not worried about getting pregnant and passing away or someone in your family going through this. So the conversation really shifted. I do believe we have a lot more work to do, but it's one of the issues that I actually think most people in the State House are now finally understanding.
What role do you think the media is playing in the perception around this, and how can we do better?
I think the perception in Massachusetts, it always happens elsewhere. And it was important for me when I did police reform to center Black women's voices like Breonna Taylor and talk about how no-knock warrants and see other use of force that is used by police departments across this country are inherently violent to Black women, right? And tie it with that maternal justice is also racial justice. You can't skip it. You know, you can't just talk about one issue and not talk about the other issue. And so I think the media, to be honest, other than you, and I think like some Urban Update, you know, when you think about City Line and Basic Black, the other media is just straight ignoring this issue. They're ignoring the issue because they want to protect Massachusetts status, right? And the stories of the women who have lost their lives and birthing people is not on the front page of the Globe. And I really think that what we could do better is that continue to talk about this issue and elevate it in every space. You know, it's important to be in community radio. It's important to be on 94.5. It's important to just be everywhere, because if we're not, people then start to believe that we solve this issue with the commission. And that is not the truth. The commission is just the beginning of conversations and recommendations that are going to be set forth to the legislature. So in a year, when this commission's work is done, we still got to push legislation. We still got to be like, in Massachusetts, we got to change these policies and procedures. So I think elevating in all levels of media would be incredibly important.
Now, talk about that commission for folks who may not know what's happening up at the State House.
So last year, women like Nneka and Timoria joined forces with Nneka Hall, and I would say about 20 to 30 other practitioners or people who cared about the issue, and really pushed us on trying to get a maternal inequities commission. And this is one of the things that I learned. One is that a lot of things are white women led, but then trying to center Black women. And so we have some work to do in that. And I really want to encourage, and they've already done this, but when we wrote the legislation, it was actually written for me. We centered the public health chairs, and this is when we talk about leadership. They're both white women, right? And the commission is entirely, it's like 99% Black men and women. And we crafted that list, and it passed unanimously in the House and in the Senate, I think in January. We had a couple of months where we went through a lot of language changes, which was really sad for me, but I was trying to hold the line. Because one of the things that we heard from the lawyers, we have lawyers in the State House, particularly the Senate lawyers who were constitutional lawyers, they were saying that basically saying Black and brown specifically was going to cause basically the legislature to have a legal battle. And we went back and forth. We saw different places where there was Asian American, there were other demographics. And so the bill changed a little bit to say communities that are disproportionately impacted of color, which we know that is the 20 minority majority communities we have in the Commonwealth. And so the commission has people that were appointed. I'm appointed as a Black and Latino caucus appointee. I didn't even realize that I didn't even write myself into the bill. So when we were like calling people to say, hey, come join this commission, I was like, wait a minute, I'm not even on the commission. And, you know, people like Dr. Charles Daniels, Dr. Charles Anderson, you have a bunch of folks, Nneka's on this commission, Timoria's husband is on this commission, and I really believe that it was structured in the right way. Now, we have only had one meeting, and so I'm really looking forward to the next meeting and creating these steering committees because I want Black women and Black men to lead. And so I think that the work of the steering committees is going to be really incredibly important to our work ahead. But basically, we're charged with studying the issue, discussing the issue, and coming up with recommendations over a year that we then can present to the legislature and say, we think you need to pass these bills, introduce these bills, change these policies in state government.
Nneka and Timoria, I want you to come into the conversation here. What has this representation at the State House meant to the work that you've been doing?
Well, for me, it's been interesting. I mean, I'm still trying to figure out my footing in that commission because I'm also Timoria and I are both on the Ellen Story Postpartum Depression Commission, and you know we've seen how already established commissions run, and we're within the this commission. It seems like we're still trying to find our footing, hopeful that we can tackle some of the problems and collectively come up with tangible solutions, and also to find out, you know, to see if any of them will be implemented. A year isn't a lot of time, especially when, you know, you have other things brewing and work and so on and so forth. So we are dedicating ourselves to doing this work and to looking at seeing what's going on in the Commonwealth. How has this fully impacted my work? You can ask me next year this time.
For me, it's exciting to see a group that is led by majority Black and brown people. I think this is probably the first of its kind, and I hope that other states work to adopt something similar. I hope that the legislators will also see that the commission should be something that continues beyond a year. This should definitely not be a one-off. As far as how it's affected my life, you know, my husband is on the commission as a person representing the spouse or partner of someone who survived severe maternal morbidity. And so what I think is great about that is that type of representation is that we rarely hear from the voice of survivors and especially their families. We also rarely hear from the voices of spouses, partners, and family members of people who died, of the women who died during a childbirth or pregnancy complication. So I think that it being a multidisciplinary group of people, I think incorporating now some newer voices is important. I also think that the tone needs to change from always highlighting the deaths. You brought up the media earlier, and what I see a lot is so much focus on Black death and little focus on Black life, and that's very sad to me because that's what's making people so afraid. No woman should be entering into what's supposed to be a joyous time in their life expecting that they're going to have a complication and possibly die. And so for me, I'm hoping that the commission is a first step towards a broader education publicly about what can we do to improve professional training for providers, and also what can we do to provide patient education so that we can empower patients along their perinatal journey, right? All the way from conception through postpartum, so that they understand their health, they're empowered to ask questions of their provider, and also if they don't feel comfortable with a provider, that they know that they actually have the choice to move on from a certain provider if they don't feel like they're being given the care they deserve.
Do you also feel like oftentimes the pregnancy and birth experience is something that folks just don't talk about? And if they have a negative experience, or if they sometimes even a positive experience, it's just there's not a conversation that's being had. And then a lot of times that allows these things to go unspoken about and also not addressed.
I think that people talk a lot about birth when it's fun, right? We'd like to talk about baby gear and decorating the room and all the sort of the fun stuff, because that's how we're conditioned as society. I think we all sort of have this vision of what birth and motherhood and parenthood is about. And when you experience something different, which can be mental or physical, right? Because we also understand that there's stigma around having a postpartum mood disorder, and there's stigma around having something go wrong in a birth, or even how we talk about natural birth versus having C-sections. I mean, you can go on and on and on. So I think that in general, when something is just different, we have trouble discussing it and discussing it openly. And so that's another reason why this commission is so important. The work that Representative Miranda does publicly, that Nneka does, that I do, and so many other advocates in this space do, is so important, because we're out here and we're saying, hey, we lived it, or we know people who lived it. Not only did we live it, but we also came through it. We have the tools, we have the resources, these things exist, and you too can have access to all those things. And this is what I feel is such a huge contributor to disparities, is that people literally don't know where to go for resources and support. They exist. I help people find resources every day for their perinatal health, both mental and physical, whether they need a therapist or they need a good OBGYN. But so many people feel stuck, or like you said earlier, Crystal, afraid to talk about certain things. And I think we have to acknowledge, especially in Massachusetts, some of that can also be cultural. There's a lot of cultural barriers to talking about birth and mood disorders and all these types of things. And so I think that it's important that this commission really gets spoken about more publicly, and also that we see them. You know, I would love to see a picture of this beautiful commission of Black and brown people. I think that it's super important for people to see the visual representation of Black people working in healthcare, for them to see Black legislators focus on improving disparities and outcomes. So much of the work we do, I think a lot of people feel like this. You feel very visible, but you're actually invisible to a lot of people. And I'm sure that Liz and Nneka can relate to that statement.
Absolutely.
All of the work we do is so public, you know, but so many times you feel like, is anybody there? Does anyone hear me? Does anyone see me? And I think that patients feel the same way. And so imagine if people in Roxbury, Mattapan, Hyde Park, Dorchester saw a picture of 30 Black and brown people who are focused on improving disparities and outcomes. What would that mean to those people? We've really got to now start to go out into the communities and let people know who's doing the work, where the resources are, and make sure they have access to those resources.
And, you know, I've been hesitating, been waxing and waning as we started this show and talking about this. But, you know, I posted this on my social that I'm 29 weeks pregnant. Very excited. But I spent last week in the hospital because I had a complication due to a very common condition among Black women called placenta previa. And you know, the ambulance was called to my house because I had extreme bleeding, and I thought I did everything right. So I had an entire Black care team. I called on my resources and to make sure I had the right folks in place. And when I was in the ambulance driving to the hospital, the paramedic said to me, what country are you from, and do you have family members here?
Mm.
That was one of her first questions to me.
Mhm.
And I said, well, I was born in Springfield, Massachusetts. We go back about 4 or 5 generations in Western Massachusetts. I'm from this country. I have been talking to you like this. This is how I sound. And so it was very, I was taken aback because I had thought of myself as a person where I had done everything right. I had set up a situation where I thought I would not have experienced something like this. And then as I was in the labor and delivery floor, getting monitored and doing all these things, they had given me a medication that had made me nauseous, and the nurse handed me an alcohol, like an alcohol swab, and she was like, smell this, because this is like our quote unquote ghetto way of giving you anti-nausea thing. And my husband and I looked at each other like, did she just say this? And then she's like, yeah, you know, this is like, it's a little ghetto, but it works. You know, girl. And I'm like,
No,
I
don't know.
Yeah. And so I was just so shocked by this behavior, because I'm also surrounded by all these doctors that have pins that say Black Lives Matter on it, and and all of these things. And luckily, the doctor who had come in apologized to me and said that nurse has been taken off of your service, because that was unacceptable. And that was a huge step. I thought that was a lot of progress, but it's just, I think the thing is, you don't know, you're in this situation where you're completely vulnerable. And I'm trying to access all of the information that I know about this topic, and how do you manage this situation, and how do I empower my husband to speak up, and all of these things at once. But in that moment, you're just like, you either have two reactions where, like I said, I'm from Springfield, you cuss her out, or you
snatch her wig,
right, or you say nothing. And that's the tough situation about this, is that how do you know, in that moment, it's so hard to manage those feelings and emotions.
And I think Timoria says something a couple our meetings ago, where I really was really understanding this, was we're all resourced women. Somehow, either through learning or relationship building or networking or our positions that God has afforded us, we're able to find all this information, right? But I always think about the woman who isn't resourced, who can't advocate for herself, who looks at a doctor or a nurse as someone above them, and therefore not able to say, I actually don't want you to be my nurse. I don't want you to be my doctor. And first, actually, I'm being remiss to say, are you okay? Are you okay, Crystal? Because I know that must have been really scary.
Yes, I'm fine, yes.
And the thing that I find about advocacy is that we always tell people that the way to root out racism is 2 ways. DEI, like, oh, you're going to have diversity and inclusion, a person doing some trainings. But it's fundamentally flawed on the second issue, where people think that we need to focus on implicit bias. The reason why implicit bias training does not work is because there are explicit structural and systemic racism built into people. And when Timoria was talking about structurally, it's in schools. And I want to thank Dr. Ebony Woolcock out of BMC. She's just transitioned to, instead of providing full-time sort of care, she's at BU Med School now, changing the curriculum. That's where we need to go. You have to train people differently, because they think it's okay. They think it's okay to think about Black women's pain as that we can always suffer through everything. We can handle it. And the strong Black woman myth is actually killing us, because we don't get the same type of compassion or empathy, or to be like, you know, actually, if you're feeling nauseous, what do you normally take? Or what would you like to do to show you that respect and care? She's like, oh, just sniff this, because, you know, it's the ghetto way. You know what I mean? Like, and so we have a lot of issues to work through, but I think we're on the right path. And I just want to say to you, it takes a lot of courage. You know, I didn't realize motherhood to me was something pretty. Babies, or when Timoria was talking about decorating a room, and Nneka was talking about like the joys, I really didn't realize like it is actually one of the hardest things you can go through. And we don't often put attention on the fact that Black women, immigrant women, other women of color living in certain socioeconomic communities that don't get the attention that they need are facing surmountable odds just to give birth. just to give birth and have healthy babies. The other side of this issue, we talk about the maternal piece, but we have an infant issue as well. Our babies are 7 times more likely to come out with lower birth rates. Even here, we have, when people talk about babies being preemies all the time in our community, I know so many of my friends, oh, my daughter was a preemie. That is a problem. You know, why is our babies being born 2 to 3 months ahead of schedule? What's happening in our backgrounds? And that's why we also need this FEMUR bill, which is an infant mortality review, because these babies mean stuff to their families. Mila means something to my family. And the fact that my sister gave birth and they just told her where to bury this child without any type of data or counseling or anything is just wrong. And it's only happening to Black and brown women. It's only happening to us because other women get this out of care and compassion and support system. But when it happens to us, people are like, you can handle it. Well, we can't handle it. We need your help, you know?
Absolutely. Nneka
One
and
thing that
Timoria,
I'd
is
like-
there anything you want?
I'd
Yeah, go
love
ahead.
to add is, I came to this work because my daughter died at 39 weeks gestational age. And I was told these things happen. And then, of course, I did my own research and found, you know, about the disparities. But then I also found out about this thing called a doula. Now, let's go back to your experience without adding the trauma portion of it. You asked, what could your husband say or do? He should have dialed your doula, because your doula should have met you at the hospital and sort of been that person to explain everything that was going on and to give you the recommendations on how things should have gone. My second to last client as a birth doula gave birth last night, and I have one more to go, and then I'm retiring as a birth doula in June. Gave birth last night after a prolonged labor experience. I knew yesterday morning that she needed a C-section, but, oh, we can do this, we can do this, we can do this. And then, you know, at the end of the day, things happened. And, you know, and everyone had to rush, and, you know, you have to listen to your body. And you also, you know, you hire a doula, and you have to listen to your doula, because they're trained to be that buffer between the medicalization of birth and to support you spiritually, mentally, and physically. We can do the things that doctors won't do or aren't trained to do. So if you don't have a doula, I can recommend several for you who will walk this journey with you and give you good feedback on how to progress. I became a doula because my daughter Anaya died. Once I learned what a doula did, I could have used a doula. She was healthy, you know, but I wasn't. You know, I did not know that I wasn't healthy at the time. My body told me that I was not healthy, and when I went back to the doctor, they said it was all in my head. And at the end of the day, I had preeclampsia that was missed. So if she had not died when she did at 39 weeks, I wouldn't be here sitting here talking to you today. So this is why I advocate for others, and this is why I get angry and yell sometimes and tell people off a lot more times than I should, because there are mothers and there are babies who are dying. Loss of a baby changes you. It changes you emotionally. The blinders come off to everything. You know, the sanctity of birth is so precious that we should be able to preserve that feeling. And we also need to stop, you know, those of us who have given birth, none of us were superheroes. So we need to stop telling those superhero stories and making our family and friends feel inferior because they're having a different experience. You know, there is no, I don't know if you guys remember back, and I know I'm older than I think all of you. But remember when Lucy gave birth to Desi Jr. and she was sitting pretty, fully, you know, makeup made, hair laid, and everything else, holding a baby that looked like a burrito. That's not the reality of childbirth. So we need to show the reality of childbirth and educate people on how to survive and thrive, during the prenatal and postpartum period.
I'm also thoughtful about if, with the Biden administration declaring, maternal health week, that was last month in April, and there being a national focus on this. Of course, Representative Congresswoman Ayanna Pressley, she also helping shed a national spotlight on this. Do we think we'll be able to move the needle forward in terms of resources and things like that? I mean, Liz, do you think this is going to be helpful?
Yeah, I first want to thank the maternal caucus. So one of the first steps that they did, and that's why I'm so excited about what can potentially happen in Massachusetts, is they created at the federal level in Congress a Black maternal health commission. And because of that, they were able to bring all of their expertise, including with Dr. Laura Underwood, I think that's her name, Underwood, sorry, my apologies, and bringing that expertise about all their different states and the issues that were happening across this country. Because although Black women die maybe 2 times the rate of white women here, that's old data, right? But in some places like the Mississippi Delta, or in some cities like New York City, it gets 4 to 8 times higher, right? And so what they did is they compiled all their data and knowledge and was able to push a suite of bills to the Biden-Harris administration to say that we have these 12 issues. We're working on veterans. We're working on postpartum coverage, which is another one of my bills. Why do we only cover people for 60 days when we know birthing families need a whole year of coverage? They have work around the environmental factors. That's what COVID taught us too, was that our environmental pollution that is causing us in some communities like Roxbury to pass away 30 years before people who live in the Back Bay, just 5 bus stops away, is telling us that the air, land, and water pollution that we've faced and degradation really and environmental injustice is helping us. So they are leading the way in inspiring states. And I think the most important thing that they did with the postpartum coverage, which I believe is going to be voted out favorably, they already discussed the veteran bill, part of the 12 bills. You can look it up. It's the Momnibus bill. I'm hoping that we get something like that. I probably wouldn't call it a Momnibus bill because I don't think that's incredibly inclusive to all birthing people that are going through these experiences together. But to look at really understanding that we need all of those bills passed. When Timoria talked about this issue, this is the long game. This is the marathon that Nipsey Hussle talked about. This is not going to be a sprint, because we're changing. Massachusetts, history is almost 400 years old in terms of what they've been teaching white men about power and superiority and supremacy that we just got introduced. I'm one of only 14 Black women who have ever served in 385 years in this entire body. There's still only 4 Black women at the State House out of 200 legislators. So we're fighting upstream. But the Momnibus bill, you can find it online. I've learned a lot from it, and I've been inspired about issues that I didn't even think about in terms of legislation. Now, I have 3 bills. We sit on this commission, and this is the most beautiful thing. When I got appointed as a commissioner, just walking into the room, you scan a room a lot. And I'm like, okay, they're the sisters. We about to have a trifecta here. Yeah. I'm going to be able to talk about things and be in certain rooms where they may not, and they're in spaces where they are, and I can't be there authentically, and so they can bring back stuff to me. And so these 2 commissions should be working in tandem. That way, when this commission meets, and I took note of what they said, and I'll definitely go back to the public health chairs to talk about, 1, how do we market this commission better? And then 2, how do we actually extend it from a temporary commission in law to actually say until this issue is solved and we see morbidity addressed in the way that we want to, which we get to 0, maybe this commission should stay on.
And let's talk for a second, and I'm sorry, but I have to put this in there. We're talking about extending postpartum care for a year, which is wonderful. But we also have to look at some of these comorbidities are life-changing, and they last until the person perishes later in life. There are some of the comorbidities, such as the heart disease aspect, that people don't look at. They don't look at the longevity of these comorbidities, many of which can be prevented. And that's another reason why everyone needs to, especially if you have melanated skin, needs a doula.
Timoria, I know you've been working on this. I mean, what do you think about this idea that there is, a national push on all of this, and how do you think it's going to affect the work?
For me, it's all just a bunch of fluff and nonsense unless real actions are taken on professional training and patient education. So just like in medical school, imagine if, or anything, right? So just imagine if you only had to take one class on heart and heart disease to become a cardiologist. Is that sufficient? So you're going to go and serve patients for a lifetime, and perhaps you've never taken an anti-racism class, a cultural competency course, nothing. And when I say class or course, I mean something that's longer than an actual one-timer. One lecture here and there, one little workshop here and there. That's not going to get it. What I'm looking to see and what I feel like is going to bring about true change in all this, really turn these disparities around, is when the institutions and professional organizations that actually accredit and give doctors credentials, right, and all these things, when they actually take the steps to say, you will not receive this degree, you will not get a credential from us, you won't have a certification or a license from us, unless you take this mandatory course, like semester, 2 semesters, whatever it is, and pass it, right? Demonstrate that you actually have absorbed this material in order to be a provider who can live up to the do no harm statement. And so for me, it's just been witnessing so much of what I would feel like is this woke advertising this last year and a half, because for people like me and Nneka, we've been living it for more than a decade, and we know people have been living it longer, right? There's advocates all over the world we've seen it all, we've heard it all. And so this last year and a half, it's just statement after statement, declarations of racism being a public health crisis. But what actual actions have been taken? I haven't seen any organizations or schools come out and say, you know what? Yes, we issued this statement, and now it's mandatory at, whatever medical school that all of our residents, they have to take anti-racism training all the way through their training, or they don't graduate. That, to me, is a real step. When you go for, as you go on through your schooling, whether you are a mental health therapist or someone who is a provider of physical health care, you still have to improve upon that. So you take you go for CEUs, you take professional trainings every year for certain things, but somehow it's okay to be a provider and not have any education about racism. And in particular, I think it's important to study racism where you actually live. One of the common misconceptions, and I love that Liz brought this up earlier, is that, racism is somehow contained to just a few states, and most of them are in the South. And I'm a person who moved to Massachusetts from another state. And so for me, I can honestly tell you that Massachusetts is one of the most racist states I've been in my life. I've experienced more racism in Massachusetts than I have in any other state. And there is this faux liberalism, this faux wokeness. And the reason why it's faux is because it's never followed up by giving Black and brown people the actual opportunity that they need to make changes. So one of the most perfect examples is what Representative Miranda brought up about the commission and how it is made up of, 99% of the people are Black and brown, but the leadership is white, right? The co-chairs are white. And so what does that really say, right? Do the Black need some sort of overseer to what they're doing? So, for me, this is all about when you're actually going to give people an opportunity to lead, make sure that that leadership is represented all the way through. It needs to trickle from every part of that, not just a little bit here and there, because it is so important that to solve this issue, that Blacks and Browns are represented on the legislative side, the advocate side, the patient side, the family side, because we're the ones being most affected.
And then I also want to ask about, in our last 5 minutes that we have here in the show, how do we want to empower people from this conversation? Common Narrative likes to give folks a toolkit. What can we do moving forward? What are the concrete steps we can do moving forward to not only help Liz, you and your work, Timoria, you and your work, Nneka, you and your work, or folks helping their own situations? And Liz, I'll start with you.
The first is continue to have this conversation in community, whether it's houses of worship. I'd love to see all the sort of major churches. Like in my community, we have 3 Catholic parishes. When we looked at the data of 02122, which is a largely Cape Verdean community, we noticed that the birth outcomes are also not as positive as we'd like to see it, even though there's a community health center there. So I would love to keep continuing this conversation, whether it's 2 people, 10 people, 100 people, keep using Zoom or doing them now that we are vaccinated more in community and with organizations that know the community. The second is to build the advocacy side, right? I am a member of Del Sigma Theta. I've talked to my sorority, I've talked to other sororities. Black women and Black families live everywhere in the Commonwealth. And therefore, they need to be talking to their legislators to make this issue a priority. It's not just about calling Rep. Tyler, Rep. Alugarda, Rep. Fluker Oakley, or myself. It's about calling the white man that is your representative that you voted for and saying, I don't know if you know that this is a big issue. The Maternal Inequities Commission's passed, but that's just the beginning. I want you to pay attention to this issue because Randolph is faced with this. Brockton is faced with this. And the third thing I think we can do is when you talk about the toolkit, most of the people in my community often don't even see their doctor or what you would call a PCP when they're ready to give birth, even with an OBGYN, until they're ready to give birth. Most of the care is done in community health centers. And community health centers are underfunded, undersupported. They have staff turnover very quickly. And so if that's where most people are getting their care, I think we can immediately work with the mass agency that covers the community health centers and have a real conversation with these other hospitals, their parent hospitals, about reinvesting and investing more in how we're actually treating those community health centers because folks need access. The last thing I'll say is that we have birthing deserts all over Massachusetts, particularly the South Shore and in Worcester County. Holyoke also is another place where they just closed a whole birthing wing. And so if people want to give birth in their community and they have to drive an hour away, that's going to impact outcomes. And so we need to be elevating this conversation about birthing deserts. I'll definitely share some resources. I was just on an event a couple of weeks ago with Congresswoman Ayanna Pressley, and the chapter created a resource booklet. It's not complete, but it was a really good start to being like, if you want to know who the experts are on this issue, here's where you go.
Nneka and Timoria, what are some things that folks who are listening right now can do?
Well, I think it's important to, just right off the bat, don't be afraid to reach out to us, right? I think that sometimes people, they don't know where to go, they don't know what to do or who to ask. So I would just put it out there. It's okay, send me a PM or an email. I'm more than happy to try to figure out how to help you. But I think beyond that, we really have to think about who is represented in the state and how they're represented. And so when we look at some of these communities, I'll take Mattapan quickly for an example, where we know there's, it's like 88% are Haitian immigrants. We have to think about the fact that there are cultural barriers, language barriers there. And, there's not going to be a large majority of people who feel comfortable questioning providers. They're not going to know who to call for resources or support. And they're also not going to necessarily be aware of who their legislators are and how to contact them. And so when I look at an opportunity, I think about a place like Mattapan Community Center, and how, it's up to, to us as advocates, and I would say also to the community and legislators and providers to all work together to see how can we empower communities where we see these types of barriers, give them these resources, which obviously, right, they have to have resources that are translated in their language. They have to, have some sort of information presented to them which makes sense to them in a way that they can accept it, both for health reasons, but also we have to take into account their culture. I think sometimes, we might sit from our soapbox a little bit because we see things as being easy to solve. If you just do, these steps, 1, 2, 3, this is how you can empower yourself. But it's not that easy. It never is. You really have to go into the community, talk to these people one-on-one, put the actual resources and support in their hands, because not everybody has internet access or mobile phone access like we all do to easily just hop on and be able to do these things. So I think it's going to require a lot of legwork. And I mean that, really mean legwork, or I mean that physically. And I think that's okay. I think there's ways to do it. And I think those ways have to be really looked into, because I think that's the most realistic solution to this, especially for communities where we're seeing the greatest disparities in our area.
Nneka, you have the final word here.
Well, it's time for birth to be given back to the community. We need to teach our communities to be communities again. There was a time when the entire community supported the birthing person. So we, as Rep. Miranda said, she was mentioning churches in her area. Let's go back to the churches. You don't have to be a member, but let's go back to the churches and have these conversations. I started a small organization called Mother Ruth's Kitchen last September, and that's based out of Charles Street AME Church. Let's pop up more of these Mother Ruth's Kitchens to support our birthing people, provide the added needed, take some of the stuff off of their table, so that they know that they're fully supported during their postpartum period. And also learn more about Mother is Supreme postpartum care. Learn more about the opportunity, what a postpartum care center would look like, and what that would mean to our birthing people.
All right, ladies, I want to thank you so much for spending some time with me. Representative Elizabeth Miranda, doula Nneka Hall, and advocate Timoria Saba. Thank you so much for being on Common Narrative. And I also want to invite you all to come to commonnarrative.media, our website where we post these shows again. If you missed any part of it, that is there, and there's a lot of resources. We're also going to be posting resources on our advocacy toolkit page on commonnarrative.media. You can also follow us on social, Twitter, Narrative Comment, and on Facebook and on YouTube, where you'll also see this episode as well. And those are at Common Narrative Media. For now, I'm Crystal Haynes, Common Narrative on Spark FM every Sunday at noon. And remember, knowledge is power and power is change. We will see you next time.